particular meeting, I found it very unique, in part because the groups that were brought together spanned a much wider spectrum of all the different aspects that could potentially determine the pathways between domestic violence or between violence against women and HIV outcomes.
You know, the biological discussions for me were very, very important, because I think that there's a lot of information that is not out there enough. For instance, there was the discussion of the fact that the infection can take place further up in a woman's body. This is something that a lot of people don't know. Me, as an educated person, was hearing it for the first time. So I think we're doing the general population an injustice by not taking this information out there.
And I think what I found really fascinating was the idea that you could actually look at a problem like HIV and look at it from a perspective of some of the more biological mechanisms for transmission to the more structural mechanisms for transmission, and the ability to actually connect the two, and the possibility to look at the data and the pathways of how these things came together was quite interesting.
I think that for me, the main message that needs to be taken back is that the linkage between violence against women and susceptibility to HIV infection is real. It is evident. We have the evidence. We may not have it packaged the way we would like it, but the linkage is real, and we need to pay more attention to that linkage.
We can begin to say, okay, this has been established. What we need to understand is what are the pathways. We need more evidence for that so that we can actually act on them.
I think in the field of violence and HIV, the predominant understanding was that sexual violence is a big modality that explains HIV transmission. However, I think if we had to sort of do some things differently now based on what we learned in this meeting, it would be that we actually need to address partner violence a little bit more comprehensively. We need to do more programming around prevention of violence as a factor for reducing transmission to HIV. How we can actually design research that responds to the needs of the policymakers. They need some very specific, often specific information around, okay, what are the interventions that are most effective? How do you cost it out? Is it cost effective or not? How do you scale it up in a real life setting? And most of the interventions that we have so far have been from trials that are in very, very special circumstances and don't necessarily always easily translate into real life situations.
For me, my first recommendation obviously is that women's organizations working with women's rights and those organizations that are working with HIV definitely need to now start to work together and not as separate entities. For me, I think it's very important that we continue this collaboration that we have begun, because really tackling the structural drivers of HIV is the way forward.